The impact is huge. And this is what I say, that I hope that the Ministry of Health allowed the GPs or the family doctors to be able to prescribe medical cannabis. Because I will give you an example of Colombia. We have like a multidisciplinary groups. The GP works with the specialist and is very close, the interaction. Because let's say a neurologist, the neurologist has been treating patients with epilepsy, refractory epilepsy, and they know that there is like a limit where all the anti-epileptic medications are not working anymore. So they know medical cannabis will be a very important tool for these patients, but they don't have the time to train themselves in something else. So they call the GP or the family doctor and say, listen, and this happens to me in Colombia. They call me and they say, doctor, I have this patient, refractory epilepsy. I know medical cannabis will be good for the patient, but I just really don't know much. Can we do something for the patient? So this is where when I talk about a multidisciplinary group. So I am in contact with that, because we know the patients, they come to our consultation, they always are coming with polypharmacy, or they have chronic conditions that they've seen in many different specialists. So it's very important to have contact with all the specialists, with the cardiologist, with the neurologist, with the internal medicine doctor, because they are medicated with many things. And with children, let's say epilepsy, it's important that the GP or the family physician can support in this process, because time, it's very sensitive matter, and the specialists, they are like totally booked all the time. And medical cannabis consultation, particularly in my case, I take like 1 hour. Every time I see a new patient is hour and 15, because it's a lot of things that you have to see and talk to the patient about. So I think it's very important to integrate the GP and the family physician into medical cannabis when the countries do the regulation, because the GP will be the doctor that will be seeing every day these patients. Also important to do the follow-up, but also always important to have the contact with the specialist. So if you ask me how will be integrated, I think the integration is beautiful, because it's teamwork, and it's not about that the GP will stop the medication that the neurologist prescribed. It's just like a communication, bilateral communication, that is always just in benefit of the patient. And it works beautiful. It works beautiful. And the specialists, they feel grateful to have the GP supporting in this matter. And the GP feels confident because knows the neurologist and knows what's happening. We need to remember that many patients are afraid to tell the doctor that they're going to use medical cannabis. So they usually come to the GP like more relaxed. And then I always ask them, who's your psychiatrist, who's your neurologist? And they say, oh, I am afraid to tell them. And then what we do is we do that bridge. We talk to, because it's very important to work as a team.